You're watching CTOM TV. Knowledge is power.
A recent study that just came out last week, which is really exciting. It was a summary of two studies called the Havana and Avarectal study. And in what these studies, what they did here is as soon as a patient was diagnosed with either a distal or a rectal colorectal cancer, it wasn't done in right-sided, just left-sided distal and rectal tumors. It was mostly rectal tumors, but they're considered colorectal cancers as distal are. What they did was prior to surgery, they gave these patients the PD-1 inhibitors, the immune therapy, and they combined it with chemotherapy and radiation. So this is before they did surgery. And this is a concept that we're really starting to understand is a huge benefit in many different cancers. So for some reason, the first tumor that occurs in a cancer, regardless of the type of cancer, it's called the primary. And we now know that the primary has these antigens on it that metastatic tumors lose. And so if you can give an immune therapy prior to surgery, then the immune system is able to build antibodies to that primary tumor and prevent the metastatic tumors from developing. So this neoadjuvant immune therapy combined with chemotherapy and radiation is really the path of the future. And in all of the cancers that we've looked at so far, we see a big difference, including gliomas, a deadly brain tumor. So these two trials were not surprising. And this is how things are going. The direction things are going in is immune therapy plus chemoradiation prior to surgery makes a huge difference. You have this window of opportunity. So this trial just came out last week. And what they found is that the major pathological responses, it means how many of these patients responded to these treatments prior to surgery, was 60% in the Havana trial and 67.5% in the Avarectal trial. The two trials differed slightly by how they delivered the radiation, but apart from that, it was the same concept. Importantly, they found that there was a reduction in grade 3 and grade 4 disease. So the grading system tells you how aggressive a tumor is going to be. And it reduced it from 89% to 36%, which is huge. And then there was a reduction in the amount of positive lymph nodes. So lymph nodes that were metastatic throughout the body, though after this protocol, the amount of positive lymph nodes went from 94% down to 21%. So this is making a huge impact on reducing the impact of the disease that is going to be lasting throughout that person's treatment. So once again, this triplet combination of immunotherapy and chemoradiation is really, in this study, it was really beneficial in the distal colon cancer patients, but I'm interested to see how it would work in the proximal too.
Thank you for watching CTOM TV. Subscribe below and stay informed.